mental health field has been around for decades. And thankfully, over the last 5 years, especially since COVID, maybe over the last 10 years, but then COVID, it really made it okay to seek care and to all that. But how do you see the mental health field changing, and is it progressing? And where would you critique our ability as a field to connect with what you know about the brain?
I think that the field, and I'm going to agree with you 100%, that one of the good things that came out of COVID was that people were more likely to say, I'm vulnerable, and I might seek help now that I'm vulnerable. It made it a little bit safer to go and get help. And even things like technology, being able to have telemedicine, to attend a therapy session from the safety of your home. And maybe you only need to do that initially, or maybe that's how you do it forever. It's opened up more opportunity. 7 years ago, would you think that it would be okay to be doing telehealth? We would be, oh, no way, this is a personal thing. You need to be one-to-one. Well, is this better than nothing? And I prefer face-to-face. It's a lot better. We're relational beings as humans, but we do the next best thing. I think that the field overall across mental health is doing a better job than we ever have. I think we're so much more open to science being involved, and not just the psychological sciences. We're actually open to, well, maybe medicine has something to add to what we're doing. And it seems to me that the fields are interacting better than they ever have. And they're open to, like, social work being more open to psych practices being more open to social work practices, and even psychiatrists coming and being very, very forthright and saying, we need this practical information too to be able to give our patients. It's great to be able to walk away. Adam and I, historically, we've actually run this training for psychiatrists and psychiatric nurse practitioners, and they've come up and said, we've had all this formal training and we recognize the technical terms, but what really helped us was the practical language that you gave to us, because that's what I gave my patients when they left the office. And they knew what to do, and it was language that had meaning to it, and it's language that actually had life. And I felt like when they left that they actually might try this. They might put these things into place.
I think going back to hope and kind of what we're talking about too is, I think the exciting part about bringing this to agency is I've got a lot of connections here. I've gotten to know a lot of people being in training. And one of the therapists I'd known for quite a few years while I'm here came up to me after the PersonBrain session he was in and said, I've heard the word trauma-informed care for the past, 10, 20 years. And he goes, it just sounded like a buzzword to me. I didn't really know what it meant. He goes, I know what it means now. I know what to do about it now. And I think that's just such a cool way to approach that.
So what does trauma-informed care mean?
Well, I'm going to say this, that if you look at our website, you're going to say that our mantra is trauma-informed care and beyond. Yeah. Because this content that we've had, it's been in there since 2004. So we were trauma-informed and didn't know it. And then we became very aware that we were.
And I feel like it's another word that if you're a listener, you might have heard this term, you might not have, but really, what is trauma-informed care, so we can discuss it from a standpoint of like, well, what are we talking about?
So to keep it quite simple, and again, there's so many different definitions, just like resilience, culture, et cetera, but trauma-informed care is basically saying that it's an approach that considers that certain populations have experienced such overwhelming events in their lives that they are unable to cope. And that's really the definition of what trauma is. What's the difference between stress, just having regular stress, and maybe even having ongoing conflict, et cetera, that cause you to be uncomfortable. Trauma is when you've had an event or a series of events that have occurred in your life that are still problematic for you right now. And that these problems are so significant that you do not possess the capacity, which is probably skills, to manage that. And as a result, you need someone who can take that into consideration, and to the fact that trauma actually produces certain reactions socially in the environment. That people who have been traumatized, have certain behaviors, certain things that are going to be obvious, and the trained clinician, when they see or hear about them, will be better positioned to put the right intervention in. But I think what trauma-informed care has done as a general practice is an awareness that we need to be a lot more open than we've ever been before, and that trauma is much more rampant than we've ever thought. And it has been a buzzword. You go to almost all conferences you go to now in the middle, there's trauma-informed something everywhere. And it starts to become redundant. And that's my biggest fear. I don't ever want to be a part of that clique that's just regurgitating the same information. What we want to know is, what are the elements to human success, to human resilience that will endure for the next 100 years?
So when your colleague said, I thought I knew what it was, or I've always heard this term, now that I know what this is, what was his statement, or what was he getting at?
I think the biggest thing that he took away from it was obviously the 4 elements of flourishing, like the safety and respect, but also just the overcomplication that we put on it. Again, I think a lot of people have heard trauma-informed care as a way of being as a clinician, but really breaking it down into these simple reimbursements. Just sometimes taking them to a grocery store, letting them experience it in a new way, or having someone there to support them while they're doing it. And just really breaking it down to these very simple, not super complicated therapeutic techniques, just like this. They just need some extra support.
Yeah, and most mental health clinicians have been trained to write very elaborate treatment goals and objectives that unfortunately they've been forced to write because for reimbursement reasons, financial reimbursement reasons.
Not psychological reimbursement.
No, not
Literally
psychological. Exactly.
Yes.
But what the danger is these treatment goals and objectives sometimes really don't even apply to what's really going on, and they're not even functional. So if you try to share those treatment goals and objectives with some of your clients/patients, they don't have a lot of meaning. But if you're telling someone that they have self-control problems or self-regulation issues of their emotions and behavior, and as a result, we've looked back and we've seen you've missed a lot of opportunities in life that other people might have had. So we're going to go back and we're going to establish opportunities to put those experiences into action. So the going to the grocery store, that 15-year-old might go to the grocery store much differently than a 5-year-old or a 4-year-old. But if there are skills that need to be obtained that will help them later in life, in that grocery store experience of walking on aisle 9 at Walmart, for example, that's what we need to be doing with them. Or going out to dinner skills. Like I had a 16-year-old foster child that came to me on his birthday who had never been to a restaurant before where someone asked you, "May I take your order, please?"
Wow.
And didn't know what to do with that. And my assumption was, even with my training, he'd been to a restaurant with the opportunity to order meat and to tell them that he wanted it medium rare. He had no clue what to do. And so when the server was asking him these questions, it caused unbelievable stress, and he ran out of the restaurant. So I had to coach him through the moment and everything. We got back and it's successful. And needless to say, I want to let you know he is one of my sons now, and he is just fine ordering at a restaurant now. So he's able to do that. But I guess what I'm saying is we make a lot of assumptions, even simply by looking at people and think, well, he's 16, I'm sure. But I'm telling you, I've had teenagers staring out the windows of my home before, looking at people riding their bikes and knowing that they can't go out there and join them because they don't know how to ride that bike. And you think about if those are opportunities that are milestones in people, think about how many other opportunities that we don't milestone in our heads that were missed for teaching a skill.
When you say neurotransactional, that term, you're describing the totality of the ways that we give and engage in. I mean, what does neurotransactional mean?
So transaction, it with some people it has a negative connotation, like transactions. They'll think, oh, that's it's very rigid and concrete and cold. But what we really think is that at first we were calling what the work we were doing is neurorelational. But that really was not fair because the work is beyond just the relational pieces. The relational pieces are foundational. We know that nothing's going to happen between people unless there's trust and respect between them. Then we know that's a foundation in therapy. You can try any therapy, any design. You do CBT, DBT, any of those formal theories and practices. If there's not a foundation of trust and respect, there's nothing therapeutic that's going to be happening in that interaction. So, I think what we have learned basically is that these transactions that we have, they occur across a number of domains. So when you just look at the reimbursements, and that's the primary framework, there are relational transactions, there are experiential transactions, there are regulatory transactions, there are cultural transactions. And that's really the exchanges that you have between you and the people and the environments that you exist in. That's really what it is. And it's the transactions, and that's usually what we're fine-tuning. How do I come up to you and greet you? If I'm an individual with autism and I don't have very good social skills, I need to be able to be taught a social skill of entering a conversation. We take that for granted. That we know how to join a group of people and say, hey, how you doing? Or even an adolescent walking up to another group of adolescents going, hey, what's up, man? Those are social approach skills. If you don't have them, you're in big trouble. And if you have them and they're not very functional and you walk up and you say something that's scary to someone else or something that's really off-putting, these people can start to shun you. And they get nervous being around you because your behavior is unusual. And that leads to a state that we in the PersonBrain call alonement. And when people are put into a state of alonement, which is being involuntarily separated from groups of people that you wish to be a part of, we've got real big problems then.
Do you think loneliness, I've heard it described as, is it an epidemic? Is loneliness everywhere? Is social media destroyed togetherness? Or where are we collectively, society, Western society? How widespread is alonement?
I don't know exactly the statistics on loneliness or alonement, but I will tell you this: we're well aware and looking at the research right now and what that impact might be, and the correlation as to when did this start. Is it because in COVID did it just bring it to our attention more? People started to be able to recognize I'm lonely. Mm-hmm. I haven't ever put that label on it.
I think a lot of people knew they were lonely before, but COVID made it so that now we're all lonely, so it's way easier to
and it could be more easy to enter into. Yeah, and then I think too, a lot of, especially males, was being able to label, oh, hold on, you know what, I'm lonely. That's what's going on here. Mm-hmm. And I think that that's something that's happened. So there's a little bit more awareness. I think that we're also asking more about that too. Like, how are you doing? How are you feeling? Are you feeling connected? People, what I'm very interested in finding out in research in the organizational sector is, what is the impact of people who are working from home? Did they suffer from a higher level of loneliness and depression? And who tends to want to work at home more?
And I think the fascinating thing about this too is that the Hopeful Brain and all the topics in there tie a lot into the new research that's coming out that's talking about the quality of the connections. Yeah. Not just that we're connected, but the quality of it. And I remember being in grad school about 10 years ago and reading a research paper that said, if you're connected online virtually with somebody, it's still a connection, it's still beneficial. Well, now we've got research coming out now that's saying, well, no, not exactly. Yeah, it's not quite the same. We don't get the same neurochemicals that we do whenever we're face-to-face and in person. And so there's a lot of that that's coming out and changing just based off the new information.
It's why I refuse to have certain meetings unless they're face-to-face, especially when you're trying to grow new concepts, establish something into a culture, then you can grow into having that kind of consultative relationship or whatever it might be. But I don't like to have, especially as you're beginning relationships, to do that virtually because it's not the same. But it can then serve its purpose later on once the relationships are established, the connections, the trust, the respect are there. Then it can have a place in what you're doing. Obviously, technology, it's going to have a place.
I don't remember if it was your presentation or someone else, so I'm attributing this to whoever I heard it from, but I don't remember. It was some slide that showed, loneliness putting into context, and it was, I think, America statistics, but historically people got their connections heavily through churches, clubs, and work. Was that your presentation?
No, it wasn't me, but I'm familiar with what you're talking about.
And those rings of church and clubs are just shrinking so dramatically that it is doing two things. One, it is robbing people historically of where they've usually found their relationships, but it also is putting ever more pressure or focus on the workplace. I think this is another reason it's so important to have these sort of shared languages. It's not just a matter of, hey, are you in survival brain, you're being cranky today. It might be also understanding those need states that we bring with us to work that might not be fed in other places like they historically were.
Yeah, and that's an extremely important observation in the sense that these places that used to serve as group meeting places, where things could be solved as a community, they're dwindling. and we're becoming more isolated. I think it's important, and that loneliness factor is, why are we allowing this? Are we aware we're doing it? That becomes the question too. Do we know what we're doing to ourselves, or are we going to learn a bad lesson?
Yeah, I think it's what's the Jurassic Park quote? Just because we could doesn't mean we should.
Yeah.
Right. And let's look at the science behind it. Let's look at the research and see what are the things that we should be doing based off of the neurochemicals that we get from it.
And if whether we're here or separated, how do we make sure that we are connected such that if you are alone in the workplace, that I can pick up on that? And how do we even normalize? Because it's not always easy or even welcomed. But let's say it's welcomed to be more interconnected. Well, what do? Do we all go play a card game at work?
What does that look like?
Yeah.
And I think that's what we have to explore. And then when we have this knowledge about what's important and what are critical aspects of healthy environments within an organization, the cultural part of the organization, I guess is what I'm talking about more specifically. But when we're looking at this stuff, I guess we need to make sure that we have some type of assessment model that goes back and finding out, are we measuring this? If we're concerned about it, we'll measure it. But if we're not concerned about it, we won't measure it. And I think that's important.
So if you run across this conversation and, maybe you like one thing and the rest is either confusing or doesn't connect, is the Hopeful Brain, is that book, who can read that and be like, okay, that is at my development and understanding level, and is it for more clinicians and people with the basis? And if so, then where would you send somebody if they want to know more?
Well, here's the whole purpose of what we've done with the Hopeful Brain and the other books that we have written as part of neurotransactional practice, is that we want to make this accessible to any reader. And we just say that we want someone with a non-clinical background. So if you have a foster parent that's just struggling and they want to say, can you give me a resource that I can look to help me understand what's going on with my foster child? We want them to be able to pick this book up, find value in it, and comfort in being able, the readability. But we also want someone who has a graduate degree, that maybe even be in a PhD in psychology, neuropsychology, to be able to pick that book up and say, oh, I'm still getting information out of this. And maybe it's not so much the technical language, but it's the practice that I'm walking away with.
Does your website have information that will be helpful to anybody, whether they are highly educated in the field or sort of a parent who's hearing this saying, I want to know more? Is the website going to have resources for all of that?
Yeah, Adam, I hope that's what it does. And that's certainly our goal for that. And, whether it's training or consultation or any of that stuff, what our goal, again, is to make the practice of helping a lot simpler and a lot more effective. And again, we feel like the essential ingredients is, one, knowing about the brain and how it interacts with our lives so that we can make the best choices as far as strategies and interventions.